Have you ever stood up, start to take your first step, and the pain in your knee becomes immense? You feel like you're going to hit the floor. Is it bone or is it muscle? Stay tuned. I'll share with you later what the difference is. Welcome back to the Muscle Repair Shop. My name is Butch Phelps, and today we're going to talk about knee pain. Did you know that 25% of adults in America will suffer from knee pain this year? That's nearly 4 million cases going to primary care over knee pain. The problem is most people think when they have knee pain, it's got to be the joint, it's got to be the bones. And what most don't realize is that many times it is actually the muscles. And if we understand how to take care of the muscles, we have a good shot at saving the damage to the bones. So let me explain. So when you look at the knee itself, from a bony standpoint, it's a very simple joint. You have the femur, which is part of the thigh here, coming down and connecting with two muscles in the lower leg. The femur is here, the tibia is the big muscle down here, and the fibula is over on the outside there. It's a very simple joint in the fact that it's the leg as it rotates. You have to have the muscles around that joint to rotate to keep the friction down from the bones themselves. Now the muscles, on the other hand, are far more complicated. When you look at your thigh, for instance, on the top here you have the quadriceps where there are 4 muscles there. On the inner thighs you have the inner thigh muscles here, the adductors, which are 4 muscles there. The hamstrings on the backside have 3 muscles there. Then you have an IT band on the outside of the thigh over here. Then on the calf you have 4 muscles in the calf, you have 3 muscles down in the shins, and then you have muscles that are running in between the 2 bones down here, so that as you rotate your body, these muscles have to be pliable. They have to be able to allow the bones to move so that you don't fall down. When those muscles are hard and they're tight, what happens is that now you put too much friction on the joint itself as you're trying to move from the ankles to the knee to the hips. But since the knee is the weakest of the 3 areas, the knee will create more pain than not. So when you look at the knee, again from the bony standpoint, in that knee we inject synovial fluid naturally from our body, which is like a WD-40. However, if the muscles are too tight, it pushes that joint closer together, and as it does that, it squeezes out that synovial fluid and it breaks off the cartilage. Now the cartilage is there because on the ends of the bones, it's much softer than up in the middle of the bone. So the cartilage then gets broken off, and now you have permanent bone damage, which may lead to a joint replacement. But there's hope. You can actually, if you understand how to stretch and release those muscles, you can actually prevent those knee injuries from happening. Wearing the right shoes will go a long ways in preventing that knee injury from happening. We've all heard people say, doctors especially, running is bad for your knees. Well, running is not really bad for your knees, except it's the shoes that you're running in may be bad for your knees. The way you run may be bad for your knees. So we want to take into account how to walk and how to run so that we don't cause that damage as well. So let's start with the muscles first. Now the first thing you want to do with your muscles is that anytime you're sitting in a chair, you can sit, let me slide back a little bit so you can see me, but you can sit with your leg crossed here, and that's going to put you in a good position to work on the back side of your calf here using your thumb. And you're not going to rub it. And a lot of people want to say massage. They want to rub it because they've had massages and they think that's what it's supposed to be about. But in this particular case, what we're doing is that we're actually pressing one spot at a time, and we're breathing out, especially if we feel a sore spot. Hold it there. Don't dig in. You're not going to push it out. I mean, everybody tries to do that, but that's not really what's happening here. But you're going to hold it, press in, and hold and maintain the pressure. Have just enough pressure that you can breathe out, okay? Because if you put too much pressure, you're going to hold your breath. You can breathe out and allow that muscle to relax and release. So here's the thing. If I press too hard, my brain senses a lot of pain, and therefore it contracts the muscles trying to stop the pain. That's not what we're trying to do. We're trying to make our muscles soft. So by pressing the spots that are sore like that, you're going to press gently, you're going to maintain it so the brain knows where to go, and you breathe out and allow that muscle to release. Once it releases, the pain will stop. And then you move to the next spot, and you work all the way down your calves. Well, you can reach around on the front side like this with your fingers, and you'll feel your shin bone running here. Do the same thing on this side over here, especially if you're dealing with shin splints. And you press with the pads of your fingers, not dig in with the points of your fingers, but the pads of your fingers, and you press in here, breathe out. Again, you're looking for sore spots there. Breathe out and allow this to just release. And as you work your way down, you'll start to soften those muscles there in that area. Why is that all important? Well, you see, when you rotate your body, especially if you play a sports like golf or tennis, for instance, when you rotate the body, the rotation starts at your ankles, and so these bones, the muscles have to be soft enough so that these bones can rotate. Because if the muscles are hard, that restricts the rotation, puts a lot of tension in the knee joint itself. Now, what you can do then on the top of the leg, which are the quadriceps here, you can actually take your thumbs, the pads of them, work one spot at a time, pressing down your leg here, and you can work all over the quadriceps. So it doesn't have to be just in straight lines. You can work all over here looking for sore spots, and as you find one, stay there, breathe out, and allow the muscle to relax. You want these muscles to be really soft. I always tease my clients, I make a living on hard bodies and buns of steel because a hard body is a body that's in pain. So when you want to do the inner thighs, come back to this position again. Now you can take and you can work down that inner thigh here, just like you did on the top, working down the thigh, softening these muscles up. While you're in this position, if you want to stretch what's called the medial hip thigh muscle here, which a lot of times if you do this and your knees popping straight up, that's a telltale sign for low back pain coming. If it's not here yet, it probably will be on your way. But what you want is this leg to be able to lay flat. And so you take your hand, place on the edge right on the point of the knee here. Don't lock your arm out like you're trying to push this out. Just let it rest there, a little more than just the weight of your hand. But you want to release from back here. And as you breathe out, just let that leg release. Now, if this is really tight, put a pillow underneath here, because as you try to attempt to get this to release, the brain may be thinking, whoa, this could really hurt. Let's contract here. Put the pillow there. The brain now says, well, worst case scenario, if I let go, it's only going to go maybe another inch. We're safe. And when that happens, then you can let go and let the leg fall back down. Okay, and you can start to free that back up. And you can do this anytime, anywhere. I mean, even doing the massage here, I've done that sitting at somebody's office waiting to meet people. So you can do that anytime you want with that. Now, when it comes to the top of your stretching, what you can do there is you can lay on your side like this here and stretch the leg. So you're just going to catch your foot and you're going to stretch the leg right behind you. Hold for the 5 seconds as you breathe out. So in other words, as you pull the leg back, you want to breathe out, hold for the 5 seconds, release it, and then repeat that 10 times. And as you do that, now what happens, the brain sees that that movement is safe. And what I'm telling you this, well, I'm only showing you on one leg, make sure you do both legs, even if it's only one knee that hurts, because chances are the other knee may be not far behind when you do that. And so those are the things, the 3 things that I would say to you I would do if you're dealing with knee pain now. So now let's talk about the shoes again. So when we're looking at shoes, most shoes, especially athletic shoes, but even some of the casual dress shoes, have really thick soles. They have arch supports and heel supports in them. And what happens is that the shoe itself cannot bend. So in other words, let me take my shoe off here so you can see what I'm talking about. You take a shoe like this here, you notice that the sole is not very thick. There's no arch supports, no heel supports in it. And you can bend this shoe just like that. what that does is that allows the muscles in your feet and the joints in your feet to actually work correctly. What's happened to most of us, especially those of us over 50, our whole lives we've been wearing shoes with arch supports and heel supports and thick soles to the point that the muscles in our feet have atrophied. So don't think you're going to go from the shoes you're wearing now to a shoe that does this and not feel some pain in the muscles in your feet and lower legs. Take your time with that. What I would suggest doing is practice walking around your house a little bit barefoot at a time. And again, even around your house, don't try to do this all day. Maybe do it for half an hour. Maybe do it for an hour if you can do that. And then put the shoes back on, and then each day keep building from that. And what you'll find is that over time, you will start to build the muscle up in the foot itself. So each foot has 29 muscles with 33 joints in it. So by building the muscles up in that foot, now what happens is that you can start to walk barefoot on hard surfaces, soft surfaces, it doesn't even matter. And the one thing that I found is that as people get into their 70s, 80s, and 90s, that as those muscles in their feet develop better, the toes are able to widen. And again, the toes widening means you want a shoe with a wider toe box. And then walking barefoot, of course, that'll allow the toes to widen more. That's going to help with your balance as well. So these are some important things to think about and look at and keep in mind what's going on with that. So happy walking. Make sure that you take care of those feet and that lower leg and get those knees where they're working good again. Let me hear your comments down below how you're doing with this. How's it working with you? Are you having questions about what to do with it? Shoot me a comment. I'll be happy to respond and we can go from there. But for now, see ya. Hey, if you enjoyed the video and you like what I had to say, please check out some videos here off to the left. You'll see a couple of videos over there. Check those out as well. Each week I bring videos to my subscribers so that they can learn new things about their bodies, new ways they can help themselves. So make sure if you haven't subscribed, subscribe down below down here. I know there's a lot of people watching my videos because the views are just going through the roof, which is amazing. But I know that many of those people are not subscribing, so make sure look for that subscribe button down below and click on that subscribe so that every week you don't miss any of the great videos that we're putting out here. My goal is to help you be able to age better. I don't even care if you're 30, to age better so that when you do get in your 60s, 70s, and 80s, you can work out better and do better things. And if you're already in your 70s and 80s, hey, we can keep you trucking on. So anyway, be sure to click down below, subscribe to this video, and check out these videos over here. Most people seem to like them. Thank you.